Morning, everybody. Just waiting on a few more people that are registered to join us, and we'll be getting started shortly. So just stand by. Hey, good morning, folks. Welcome to this virtual training session for TraumaSoft EMS ePCR. Um, Start off, let you know that on Sunday, August 31st, all ambulance calls will be dispatching handled by TraumaSoft system, and all patient care reports will be completed using the TraumaSoft ePCR functions. This is the final stage of converting our organization over to TraumaSoft. Today's training, we're going to cover the essentials of getting started in ePCR, how to access call information, how to create an electronic patient care report, key data fields that you need to be aware of. We're going to talk about how to finalize or close a chart. And we're going to wrap up today's session talking about TraumaSoft MDT app. So there are two ways you can access TraumaSoft ePCR. You can either access it via the website, which is ut.traumasoft.com. We'll log into your TraumaSoft account as you normally would. And along top of the menu bar, if you scroll all the way to the right-hand side of the screen, you'll see a button that says More. Clicking that button that says More, scroll down to see ePCR and click on that tab. This will open up the ePCR system in a separate browser window. The other option for accessing ePCR is through the ePCR app. This is a standalone app that has been installed on all the company tablets and iPhones. You do have the option of adding this to your own personal device if you wish. It's available for both Android and iOS. The app can be downloaded from your respective app store. If you're using the app, when you tap on it, you will be prompted to sign into ePCR. And we strongly recommend that before signing in, you reload the app by clicking the button that says Reload, highlighted by this arrow. This will ensure that you have the latest information and updates to the CAD system. Then to log in, you're going to use your standard TraumaSoft username and password. Whichever way you access TraumaSoft, either through the website or through the app, you will always be prompted or started with this privacy screen. I strongly recommend that you read through the privacy statement here at least one time, so you're familiar with the information that it's saying. After reading through it, you're going to click the button that says I agree to the above statement, and then hit accept. You will need to do this every time you log into TraumaSoft. Once logged in, you will be brought to the current calls screen. This is where you will see any open runs assigned to your unit. If no calls have been assigned to you, this screen will appear blank. To start the ePCR, highlight the particular call that you would like to begin. And then again, on the menu bar at the top of the screen, all the way to the left, you will see a button that says Actions. Click on that and scroll down to the tab that says Start ePCR. Now, it's important to remember that TraumaSoft and the ePCR function is used by all of the KQT health organizations. That includes Pennsylvania, Maryland, Delaware, and the District of Columbia. It's important to remember that each of those jurisdictions has different documentation requirements, and the PCR for that area must comply to those requirements. To help ensure that, we have different templates set up. For PA operations, you're going to be using the template labeled PA EMS v3.5 or version 3.5. To select the template, simply choose the version you wish from the drop-down menu, and then select Choose Template. Once you've selected your template, you will be brought to your ePCR screen. So looking at this screen, we're going to look at a couple features. Along the top left of the screen, you will see the run number. Please note that the run number in TraumaSoft is formatted differently than what you're used to in EMS charts. Here, the run number year, represented by 25 in this case, appears at the end of the run number. Staying on that same line, if you scroll over towards the right, you will see currently what says test test. This is where your patient's name would appear had it been an actual run. Moving down to the next row, that starts with the tab and then progresses to patient vital signs and etc. Think of these as your pages that would typically have run down the left side of the screen in EMS charts. Below that row is another set of tabs. The screen example shows response, scene, personnel, position, and so on. These are sections within each of these pages. You will also take note to the red boxes that appear on this screen. This shows the number of required data elements that need to be completed in order to finalize or close this PCR. As those data items are completed, this number will decrease. That box will eventually disappear. TraumaSoft ePCR was designed for the field provider in a mobile-friendly format. The system primarily uses drop-down menus and large touch buttons. Systems designed to be used on a touch screen, such as your tablets or phones. The configuration of the pages and screens will format to a mobile device, making it very simple to use. Here you see an example of some of the data fields. What you should take note of in this screen are the boxes that appear next to. When the item is once the data element has been appropriately answered, the box will turn green. system is fairly self-explanatory. If you read the questions or the data element name, you should be able to figure out what information is. But if you're ever unclear, simply take your mouse or finger and tap on the element, the field element title, and a screen tip will appear. Of the information that is requested. Feature of TraumaSoft ePCR over charts is that we no longer will be doing a written HPI. Your HPI statement that will not have ePCR. These questions are actually built into the charting system, and you will answer those throughout the charting process, not just in a HPI section. So here in this example, from the incident page scene section, we see the data element question: why is the patient at sending facility? Include admission, diagnosis, and procedures completed. This is a required field, and says the box is green. Response sample answer here says the patient was admitted on 8/9/25, break hip fracture. Now this is a text entry field, meaning you would have to type in the information for your response. The field is limited to 80 characters. And please be short and to the point. However, you do need to use proper grammar, English punctuation, and such whenever you're completing your patient care. This would be HPI question number 2. Continuing on in the chart with specific fields, the incident page destination section, you'll see this question. Why is patient going to facility? Where treatment the patient received there? Well, this is your HPI 4 question. And again, this is a text entry field, so we want you to be sure the point. The example in this case says the patient is being admitted for an inpatient rehab for physical therapy. So TraumaSoft ePCR system, along with its companion MDT, which we'll talk about at the end of this lesson, utilizes status buttons to track the different phases of a call and the time at which those phases begin and end. Buttons, particularly at the end of this lesson. For now, it's important to understand that all times must be entered and documented using the MDT function. You are not permitted to write in times. You are not permitted to write in times on your own. Once times have been recorded in the computer-aided dispatch system. To retrieve those times or any other information that may have changed or been updated, returning to that home screen of the patient care report, next to the run number, you will see a pencil icon. Clicking that pencil icon will activate a pop-up screen that asks you if you want to edit the run. Should you want to edit the run, click Edit Run button. On the next screen you see, you will have the option to pull CAD data. This is a checkbox option. It must be checked in order for the CAD to pull information down into your patient care report. Once you've selected the green checkbox, click the green checkmark button, and any updates in the CAD, including times, will be updated in your patient care report. Vital signs. Vital signs have not really changed, but we would like to emphasize when proper vital signs should be obtained. First set of vital signs first set of vital signs should be obtained in association with your primary assessment shortly after your outpatient time. It is unacceptable to take vital signs after the patient has been loaded into the ambulance and transport has already started. The reason for this set of vital signs is to show and document the patient's status as they were being as transport was beginning. The second set of vital signs that you are required to obtain uh, is your transfer of care vital signs. These vital signs should be obtained within 15 minutes of your transfer of care. The purpose of this set of vital signs is to show the patient's condition at the time of transfer, particularly that they were alive, breathing, and well. Finally, as an EMS provider, you should regularly reassess your patient every 15 to 20 minutes throughout the course of your care and time. Another difference from EMS charts moving over to ePCR will be the documentation of oxygen. Oxygen administration will be documented under the medications page, administration section. The treatment page, medication section. Remember that oxygen is a medication and needs to be documented as such. So, to enter an oxygen administration screen, click the green plus button that says Add. This will bring up a new dialog window in which you will fill out the information. As previously stated, TraumaSoft ePCR is very intuitive, and you can read the screen statement. You can be able to figure out what exactly is being asked. But if you ever have trouble, just click on the element title, and a screen tip will show up for explanation about what is being asked. Particularly with oxygen administration, you want to be sure to include things: oxygen as the medication name, the delivery device, the flow or the dosage. In this case, it's 2. And finally, the measurement system. In the case of all oxygen or medically grade gas, it will always be liters per minute. You'll also notice a red arrow on this page. This is highlighting a particular question, and that question is medication administered prior to this unit's EMS care. This case is answered yes, because our patient was already on supplemental oxygen. Remember that as an EMS provider, you do not have the ability to determine on your own if someone should be taken off of oxygen. ePCR over EMS charts is that ePCR does not use any kind of special reports. The most common special report that we used here at Keystone Quality Transport was the behavioral health care call. Well, in the TraumaSoft ePCR program, there is a question that will ask you, is this a behavioral health care transport? If it is not, simply click no, and move on with your chart. If it is, click yes, and a new set of questions will populate for you. Those questions are the same that you would have found on a behavioral health special report. Now those questions are just integrated to the chart for you to complete. Signatures. With TraumaSoft ePCR, you're going to begin to collect signatures in an electronic format. There's a couple signature types that you need. You need your patient signature. This can either be their actual signature, or if for some medical reason they're unable to sign you can use a Section 2 representative. For either of these options, click the button with the appropriate section title, and a window will pop up allowing you to sign, or in this case, allowing the patient to sign. The same is true with the Section 2 authorized representative. If someone is unable to sign for themselves, click the Section 2 button, and you will be able to choose which option, family, relative, caregiver, so on, is signing for the patient. This replaces the signature sheet on the white copy back of your patient transfer of care form. You are still required to complete the transfer of care form for all non-emergency ambulance cases. Finally is the signature for the receiving facility. If you click on that link, it will open up a new window in which your healthcare provider can sign the PCR or sign your patient care report for you. I don't have a slide for it, but it's also important to know that both members will need to sign PCR in order to close it. Now, it is possible in TraumaSoft to set up a signature that will be pulled into the ePCR so that you do not have to sign your name every time. That function could be found under the My Files tab of TraumaSoft. About 2/3 of the way down, you will see a link for signature. You can go ahead and create an electronic signature now and save it with a PIN. And afterwards, when your partner asks for your signature, you can simply enter a PIN number and the chart will be signed. The last of the HPI questions is going to be found on the billing page in the details section. And the question is really simple. The purpose description. Then this is your traditional HPI 5 question where you consider medical necessity and the reason the patient was moved by a stretcher. This again is a text entry field. It has a limit of 80 characters as well. So again, we want you to keep it short and sweet, but still maintain good English grammar and such. Another feature of EMS TraumaSoft ePCR is the ability to attach documents to the patient care report. So currently you should be collecting a face sheet or demographics form, a physician certification statement if one is available, the transfer of care form once it has been completed, and then if the patient has an out-of-hospital DNR, you should be attaching a copy of that as well. In order to attach documents to your chart, from the attachment window, scroll down and select the document type you wish to attach, and then click the Use App Camera button. Doing this prevents any medical legal notes from being stored on your device. The other thing to know about the attachment section, call takers can attach documents to the run as they take the call. So as an example, if a call taker receives a request for a transport and the patient, and they've already sent over the physician certification statement, the PCS form, the call taker can attach that to the chart. That item would then be visible to you as the care provider for that patient. As you finish up your data fields, TraumaSoft ePCR will let you know if there is anything missing. Missing items will be highlighted in a light red pink color. By clicking on any of those bubbles, it will take you to that exact part of the patient care report so that you can complete all the required data fields. Once all the data fields have been completed, and this screen does not show any additional open elements, you can go to the narrative page. Now, TraumaSoft ePCR does use a narrative. This is something very different from EMS charts. However, we have configured TraumaSoft so that everybody must use the auto-generated narrative function. To use the auto-generated narrative function in the narrative page, select the template that you wish to use. In this case, it's PA Medical Transport, and then click the Generate Narrative button. This will generate a full detailed narrative based on the information that you supplied in the patient information section. You are encouraged to read through the generated narrative, review it for mistakes or errors. If you need to add additional information, you can do that. However, you cannot remove anything that has been auto-generated, and you are not permitted to write your own narrative freehand in your own format. Once the narrative has been completed and all other required items are done, you will be prompted to finalize the run. This is the equivalent of closing a chart in EMS charts. Simply click the button. As previously mentioned, TraumaSoft ePCR does not utilize special reports. Remember that the purpose of a special report is to send an alert out for an unusual situation, occurrence, or something that may have an impact on the patient care transport experience. We've mentioned that behavioral health care transports will be handled within the chart themselves. But some other frequent examples of special reports were patient or facility concerns, lack of clinical concerns, either BLS or ALS level perspective. These incident reports will be found in the company links section of TraumaSoft and should be completed there. As we looked at before, a regular patient chart has a lot of data elements that needs to be completed. In utilizing ePCR, if you have a lift assist or a canceled run, all of those data elements are not required. To get to the correct number of data elements, you're going to return to that edit screen that we previously talked about. Up at the top left of your screen, you'll see the run number with a pencil icon. Clicking that pencil icon will bring up the edit run box. Here, you can change the template from a BLS template or ALS template to a cancellation/lift assist, and then check the green box or click the green checkbox. After doing so, you will see that the number of required data elements for a cancellation chart has gone down to just 5 elements, all of which are on the incident page and in disposition section, just 5 elements. Okay, so next I'd like to spend just a few minutes talking about TraumaSoft MDT. TraumaSoft MDT will be replacing Mobilis. They work essentially the exact same way. And this app has been installed on the company-owned tablets and phones. Log into TraumaSoft MDT, click the icon and allow it to open, and you're going to fill in your name and your password from TraumaSoft. Always be sure that the domain is directing you to akt.traumasoft.com. Once logged in, let me back up for a second, give you a key point here. A big difference between TraumaSoft MDT and Mobilis. Once you sign in, you only need to worry about signing yourself in. Whereas Mobilis, you had to select the correct crew members, and then the right unit number. With TraumaSoft MDT, that information is all done on the back end, so you do not need to put anything in. You will just sign in using your password and your username. When a call has been assigned to you, like Mobilis, your device will alert you. If you click the green button that says View, TraumaSoft MDT, much like Mobilis, uses status button to track the different phases of a call and the cost associated with that. The TraumaSoft MDT buttons are configured for at scene, at patient bed, transporting, at destination, and then finally cleared. TraumaSoft information tabs, trip information, including run number and the type of call that it is. The pickup and drop-off screen showing you where you will be getting your patient from and where you will be taking them. Each of these has quick links to Google Maps, which can be used for then navigation. The MDT notes section, so dispatch notes. Something you would have noticed in Mobilis is that it had a character limit. So at times it appeared that the dispatch notes would just abruptly end. Where with TraumaSoft, there is no character limits, and as long as you keep scrolling, you can read additional notes. Finally, the patient information, including phone, date of birth. Please remember to verify all this information when transporting a patient. So with that, that is the end of this particular presentation. So as I stop it, if you have any questions, please feel free to take yourself off of mute and fire away. Questions? All right. If you have no questions, you have completed your TraumaSoft. Oh, wait. You make a reverse trip. No, there is no reverse trip for this like there was in EMS charts. However, the information that you put into TraumaSoft on your first leg will go into the CAD system, and the CAD will pull that and will drop it into the next run because it will associate the patients together. That was a good question. Thank you. If you have no other questions, you are free to drop off at this point. I will be staying on for another few moments. In the event you think of a question, you can ask. Otherwise, have a great day. This system goes live August 31st, this Sunday. And no, you cannot start a chart unless it has been assigned to you through the CAD. So with EMS chart, you were able to create essentially a blank chart. You will not do that with TraumaSoft. Once the call has been assigned to you, you will be able to create or open the PCR. Like I said, thank you for joining this. And as always, if you have any questions, especially during the rollout period, doing charts, don't hesitate to contact myself or Mike Moretti, and we will help you work through any issues as you get used to the new system. Have a great day.